Premier, I wanted to ask you about the paid sick leave issue. Ontario talking about doubling the federal program. The Prime Minister today suggesting he would like to see provinces implement their own programs through businesses. What are you looking at from your government? Are you looking at helping the existing federal program, a BC program? And when can we hear some details on that from you?
Thanks, Rob, for the question. And we've been focused here in British Columbia on establishing a national paid sick leave program going back to last May. I remember quite vividly raising it at the Council of the Federation with my colleagues, premiers from across the country, and with the Prime Minister. And at the time, there was little appetite for it. I tried to make the case that as we went through COVID-19, of course, you'll remember we were in the early stages at that point. No one anticipated that we would still be here a year later. But the objective of the province, and that was involved, I have to say, Greg Davignon, the BC Business Council, the BC Chamber of Commerce, the BC Federation of Labour, and a range of other organizations wrote to the Prime Minister and said, we need a national program so that people aren't making a choice between going to work sick and staying home to meet the needs of their families. And the Prime Minister agreed with that, ultimately. Brought forward a program that clearly had gaps. We identified those gaps, as did others. We raised the issues with the federal government, and we had hoped that their budget, the day before our budget, would have done something to address those issues. Having said that, we were disappointed to see no progress, and therefore we've gone back to the shelf and taken the programs that we were working on here in British Columbia, and we're trying to get those up to speed to fill the gaps at the federal level. I have not engaged with my colleagues, other premiers, at this point. I know that Premier Ford has made some suggestions that have not been well received. He has not talked to me about them, but I know we have work underway, and we'll have more to say in the days ahead. And I appreciate that British Columbians are focused on this issue, as they should be, and as we were 12 months ago. But we are where we are, and now the challenge for us is to make sure we bring forward something that can supplement the work that the federal government has already done and will meet the needs of working people.
I'm wondering, Premier, if you can just clarify, do you think British Columbia needs a mandated sick pay program, or are you talking about something that deals only with the pandemic?
Well, I think at the start of the pandemic, it was all about the pandemic. But what we've learned, not just in people who are not able to go to the workplace, but people that we don't want to go to the workplace. We've seen outbreaks in industries because people have not been able to make that hard choice. They've had to go to work to meet the needs of their families. So clearly, this was a need throughout the pandemic. But I think certainly other jurisdictions have paid sick programs of one kind or another. Ontario did have one, and it was eliminated just a couple of years ago. So we're looking at not just the pandemic, but what can we do to protect workers and businesses, most importantly, going through this. And we're going to try and find a collaborative way to do that. Again, I want to thank Greg and the Business Council, Chamber, and other industry organizations, the boards of trade, who wrote with one voice to the Government of Canada saying a national plan is a solution for an integrated economy. I still believe that's the case, but I understand that the federal government has done what they believe is enough, and we'll be left to fill the gaps.
Follow-up, Justine?
Yes, thank you. Can you give me a sense of a timeline then? Because I've spoken to public health officials who say there are people going to work today with COVID or symptoms of COVID, bringing it into the workforce because they don't have that choice. So it does seem to be a very urgent problem right now.
It is, and again, we were hopeful that the federal budget would have contained elements of filling the gaps and having a genuine national program. That didn't happen. Obviously, we weren't able to amend our budget documents, which came the next day. I know Minister Robinson was speaking with the Chamber of Commerce here in the Capital Region and talked about her plans and how she's mobilizing staff. I know that work was done through the summer to bring forward a provincial plan, and we're taking those off the shelf, and we're looking at how we can implement that in a seamless way without putting more burden on business at a time when business can least afford it. But we have to keep in mind those workers that are faced with an extremely difficult choice. We want to eliminate that, take the stress off workers, make sure that they don't make the choice to go to work when they're sick. And I think to to bring this home outside of COVID, I don't know, I'm sure that there's not a person watching right now that has not dragged themselves out of their sick bed and gone to work declaring themselves a hero because they're going to take one for the team. Well, what we've learned from COVID-19 is that's not what we want. We don't want heroes. We want people who take care of themselves and don't put their colleagues, their customers, and their businesses at risk. And people shouldn't have to make that choice. I believe it's the responsibility of all of us to fill that gap, and we're going to find a way to do that.
Richard Zussman, Global News.
Sick pay is a priority for the province, but yesterday we heard an announcement from Minister Calon adding additional money for businesses that were impacted by the circuit breaker. You moved quickly, you put money in place quickly, and now we're sitting here at sick pay a year later, and you aren't filling the gaps. Why aren't you moving as quickly on this as you are on other issues? Is it a matter of cost? Or is it a matter that this is just something businesses don't want? Like, what wall are you running into that makes this not enough of a priority to move as quickly as the circuit breaker grant?
Well, primarily, Richard, it's because there's no mechanism to do this. This is not something that's regularly done. As I said, we do not want to hamper industry at this moment, at a critical time in the pandemic, with additional costs. So we're going to find the resources. The resources are not the issue. It's the delivery of the programs. And we were not delaying. We were aggressive about this issue, and you covered it months and months ago. The federal government committed to a program. They delivered one. It wasn't sufficient. We asked them to fix it. They haven't. And now we're stepping up. It's not about speed. It's about making sure we get it right. This is a challenging time for all of us. I get that. And this is something that I had hoped that we had turned the page on, but clearly we haven't. That doesn't mean we can't continue with other initiatives. The additional circuit breaker resources were critical because we were asking industry to take another 4 weeks so that collectively we could come through this stronger than we were before it started. So that was priority number one. Today we're talking about the future post-May and into the fall, when we're looking at anchoring and encouraging more economic development in those key sectors that are so critically important, not just to British Columbians, but indeed the world. I believe we're moving as quickly as we can on a whole range of fronts. We have been absolutely clear here in British Columbia that paid sick leave is critical to get through the pandemic, and I believe we'll get there as quickly as we possibly can.
A lot of the people who would benefit from this are people who are on the lower end of the income scale. Often they are racialized. So what message do you think it sends to those workers in the middle of a pandemic that neither the provinces or the federal government has been able to put together a sick pay program?
Well, I know there's going to be a lot of disappointed people, and I'm among them. We worked really hard. We were the lone voice last summer on this question. We received commitments from the federal government that they got it, and they did. They put in place a program. Unfortunately, that program was unwieldy and didn't meet the needs of the very people you've just mentioned. And so we're circling back to take charge of that issue, and we're going to deliver it for the people who need it. But again, I don't want to sound overly whiny about this, but we had commitments and a growing support through industry, labor, and communities that this was the way to go. Everybody gets that, but we didn't get the program we needed at the time we needed it from the federal government, and they've done a lot of great things over the past 14 months, but this is not one of them, and we're going to have to do our best to fill those gaps. And if there were a way, as the government of Ontario has tried to do, to just supplement it by giving money to the federal government, we would do that. I don't believe that's effective or would work, so that means going back to WorkSafe BC. It means going back to the Minister of Finance and finding a way to deliver these resources. How do we get the money to people who are taking a couple of days to get a PVR test or any other illnesses that they may have through the pandemic? It's not a simple process. There is no structure in place provincially to do that. And that's why I emphasized and leaned in to the need for a national program. And that's why we're going to have to take a few more days to figure this out.
Lisa Houston, News 1130.
Hi there, Premier. Regarding the sick time, it's just not taking time off when sick that employers are running into walls. It's just getting time for COVID tests. I'm hearing from one doctor who says every single day she's getting at least one request for a note from her to either take time off for sick or because they're sick or to go get a COVID test. So the message isn't getting through. So not only are these people not getting paid, they're having employers that are still giving them a hard time about this. So I'm wondering what more can you do on that end?
Well, I think the vast majority of employers understand the importance of an initiative like this to protect their workers, those that are ill and those who are not, and to give confidence to their customers that they are operating a business with the highest standards through a global pandemic. I appreciate that there are a lot of challenges here, and you've identified a couple of them. I believe those could have been addressed through the unemployment insurance program, where the federal government has access to all of the names of people who pay taxes in Canada. We do not. We can use our tax information for tax purposes, not creating other programs. So there's a whole host of privacy issues and a range of other challenges. I know that's cold comfort to individuals who are struggling with health issues, businesses who are worried about how they're going to keep their workforce safe, and also, of course, healthcare providers who are being taken away from the important work they're doing to provide documentation about testing. These are big challenges, and it's sad, I think, sad to say at month 14 that we haven't resolved this issue. It was a critical issue 12 months ago, and we're still talking about it. That disappoints me. And I know it disappoints British Columbians as well.